Andrea Asher is a 63-year-old white female that presents to the clinic complaining of rash on her leg that will not go away and it is starting to spread. Her past medical history shows that she has asthma and seasonal allergy. Her family history is not that pertinent. Her father died at the age of 60 from black lung disease. Her mother is 90 years old with hypothyroidism and hyperlipidemia. Her social history. Um, the patient denies smoking and using illicit drugs, admits to drink 3 alcohol beverages per day. Her current medications include Montelukast sodium 10 milligram, which she takes 1 tablet by mouth at bedtime for asthma. Albuterol 90 microgram per puff that she inhales 2 puffs every 6 hours as needed for shortness of breath. Also, levocetirizine 5 milligram, which she takes 1 tablet by mouth at bedtime for seasonal allergy, and EpiPen 0.3 milligram that she injects as needed for allergic reactions. The patient is up to date with her childhood immunization. She also has her PPS V23 vaccine and her influenza vaccine for this year. The patient allergy. The patient is allergic to bee venom, latex, and clindamycin, for which she has hives and anaphylactic reactions, respectively. Her review of system. Her review of system indicates a left lower extremity and tenderness. As for her physical exam, there is no mental status of change. The patient is conscious and alert. Non-purulent rash, edema, demarcated swollenness on the leg. And her vitals today, her latest vitals shows that her blood pressure is 124 on 80 millimeters of mercury. Her heart rate is 65 beats per minute. Her highest temperature is 102.2 degrees Fahrenheit, and her respiration per minute is 18. The patient has a height of 63 inch and her weight is 200 pounds. Her BMI was calculated to be 36 kilogram per meter square. Her laboratory results. She has a creatinine level of 1, her BUN is 12, her glucose level is 99, and her white blood cell count is 13,000 cells per milliliters. The problem is stated to be moderate cellulitis. Evidence of the problem. It's a non-purulent rash on the left lower extremity, cutaneous erythema, edema, palpable and yielding with demarcated borders. It's a unilateral rash on her left lower extremity, rash that has not gone away for 7 days now and is beginning to spread. Her labs today, as indicated before, shows that she has a high level of white blood cell count, which is 13,000 cells per milliliters, and her temperature is also elevated, 102.2 degree Fahrenheit, indicating a fever. This indicates, and these two labs indicate an SIR score of 2, which according to the clinical practice guideline of infectious disease, it's considered as moderate cellulitis and needs to be treated intravenously. Also, given that the pathogen is non-purulent, it indicates the presence of a Streptococcus pyogenes. So the regimen that has to be chosen has to cover Streptococcus pyogenes. Our goal for this patient is to eradicate the infection, prevent mortality, and prevent complications like the spreading of the disease to other parts of our body. So the plan is to initiate cefazocin 2 grams intravenously every 8 hours for 5 days. Most important is efficacy monitoring. We need to continue to monitor her temperature and her white blood cell count, making sure the edema, the redness, and the rashes are going away to prevent the spread. As safety, we need to monitor hypersensitivity, monitor her creatinine clearance, and the patient might experience nausea, vomiting, and some GI upset. That is all I have. Thank you.